As bankers, we know that we have to change, right? We have to change, facing like new regulation, new technology, multiple changes in RT. We know that we have to change at the level of our own institutions, but also across institutions at system levels, right? And we're at Cybers here, if you think trade finance and things like that, you cannot change even at the institutional level. It's across the system, right? I don't know if it's a good news or a bad news, but we are not alone in that situation. Other sectors face similar challenges. And healthcare is an example. So I'm quite excited that Mark in a moment will share his own experience, and we are very fortunate to have him here today because he brings more than 30 years of experience in this sector and changing that sector as a leader, being a CEO, being an advisor, and I think we can learn really a lot. Maybe a few words regarding healthcare. Obviously, it's very interesting because it's a very difficult sector to change, right? It's notoriously difficult to change hospitals, doctors in hospitals, so we can learn a lot out of that. Also, the stakes are very high. It's about life and death sometimes. Some of you are probably not from the US. Mark brings experience from the US. As you will see, despite the fact that the health system is organized a different way in different places of the world, Europe, and even within Europe, UK is not the same as France, obviously. The learnings and the challenges are pretty similar, so I think we can all learn a lot. So without further ado, Mark, why don't you take us through your experience and the challenges of your sector?
Thank you very much. Thank you. Well, it's a privilege to be here, and maybe just to set the context, as David said, I had the opportunity to serve as the CEO or the COO of 3 different health systems over my career. And health system is a term that we use in the United States. It really means large groups of doctors, physicians, home health care agencies, clinics. Everything's all kind of under one corporate umbrella. So that's the entity that I worked for as CEO or COO. And I want to take you back to 2008 for one of those health systems that kind of started my journey on transforming healthcare. At Fairview Health Services, it's a $5 billion annual revenues organization in the Twin Cities, Minneapolis, St. Paul, Minnesota. We had just finished a large negotiation with one of our large commercial payers, insurance companies. And it was a typical negotiation. They wanted a 10% drop in rates, and we wanted a 10% increase in rates. And the whole structure is based on volume. So it was a price per unit that we delivered to patients. Well, we finally settled on this, had a celebratory dinner, and the CEOs were sitting around celebrating that we had a successful negotiation. And suddenly they looked at each other and said, I don't think we did anything other than rearranging the deck chairs on the Titanic. We negotiated a new deal that was really just based on doing more volume and not really bringing more value and helping to decrease the affordability of healthcare to our community, to our patients that are our customers for healthcare. So that was kind of a pivotal moment in my career where we then set about on a journey to say, what can we do to change the way things are happening? The healthcare environment is rapidly changing in the United States. You see lots of things happening on the regulatory front with healthcare reform. Many of you have heard of Obamacare or the Affordable Care Act. This is a new law that was passed in 2010 that really began to say we're going to begin paying more for quality and outcomes and not just paying for doing more things. And it's particularly relevant for U.S. health systems. 50% of our business as health systems, again, these businesses with doctors, hospitals, everything all together, 50% of our business is Medicare for the elderly. So it's our largest customer, if you will, and the government now is regulating how we care for those patients in a whole different way. Foundational to the Affordable Care Act is something called the Triple Aim. This was coined by Dr. Donald Berwick, a physician from Harvard, about 10 years ago. And he basically has a fundamental premise, and he was the CMS administrator, the administrator of Medicare when this was enacted, that says if you focus on improving the quality, if you focus on improving the experience of care and reducing the variability that occurs between patients that are out there, you end up getting a better and lower cost of care. Another big change in my career is back when I started 30 years ago, all the physicians were independent. They had their own private practices. They hung up their shingle and were family doctors or cardiologists or specialists. And today, more than half, approaching 2/3 of the physicians in the United States have become employed by the health systems. Why is that happening? Well, physicians are looking, number one, to seek a little shelter from the storm. It's very challenging within the practice of medicine from an economic standpoint. Even as I talked about the healthcare reform, the Medicare healthcare reform is dramatically decreasing the payments, almost by 10% over this decade, to physicians and hospitals and others. So they're challenged economically as physicians, but frankly, as a health system, my interest in employing physicians was really to say, what can we do to align the interests between the physicians and the health system, the hospitals, the clinics, the home health care agencies, everything else that's part of our health system? Often we are functioning in our own silos. So as we think about our theme for today, innovating outside the silos, that's much of what we were trying to do with physician employment as well. Common theme that you'll see most everywhere. Another theme within the U.S. healthcare industry is mergers and consolidations. We're seeing tremendous numbers of mergers and consolidations across the industry of hospital systems linking up with other hospital systems, of physician practices scaling up to become larger, them joining big health systems as well. We see pharma companies merging with other pharma companies, technology companies merging with technology companies. Why is all that happening? Well, they're really trying to create scale in order to really get financial synergies from that scale that they can create, take out excess costs that might exist across the industry. They're at the same time also trying to have a bigger footprint in the markets that they're at so they're able to serve more comprehensively the patients in those communities. The last 3 years have been record numbers of mergers and consolidations in the healthcare industry. I don't see it changing. There's a dramatic increase in mergers and consolidations across our entire industry. And lastly, and I'll finish with this one on this section, is there's this relentless focus to reduce costs. I mentioned earlier that the Affordable Care Act is reducing the payments to health systems. What we see is that the math is simple from a business standpoint. If you think about our businesses as health systems, half of our business is Medicare. That's impacted by the Affordable Care Act. What you may not know is we're losing money on all of that care that we deliver. Medicare pays us below our cost of delivering that care. So and further, Medicare is our fastest growing product. So I'm trying to put this in business terms. Our fastest growing product, which is our largest product that we're already losing money on, is going to be cutting our payments even more over the next decade. So it's causing this relentless focus to say, how do we make money on Medicare? How do we actually create value for our patients and allow ourselves to keep our doors open? The average operating margin for your health systems in the United States is 2 to 4%, razor thin. 2 to 4% operating margin for these health systems. So that's why it's important, and you'll see this relentless focus on what can we do to try to make healthcare more affordable. David, what are the similarities with banking?
I mean, what you've just described, Mark, is of course specific to your industry, right? I mean, the first to say, but if you step back, I think I see a lot of similarities. I mean, regulation for sure is something that deeply affects banking. New regulation, more regulation, that one. I mean, new consumer habits, right? I mean, that's also something which is clearly at play in our sector. Technology, more technology everywhere. Rising cost of some of technologies and the system to deliver what our customers demand. So. Despite the differences, I see a lot of analogies here. And one thing which for me is quite striking is that, you know, if you think about it, nobody wakes up in the morning and say, hey, today I'm going to buy surgery, right? Let's go to the hospital, I'm going to buy a treatment, right? Actually, that's not how it works. And people actually very often don't even want a treatment, they don't even want to get the cure. If you think about chronic disease, right? I mean, it involves trade-offs between longevity and quality of life. And this is, you know, complex things, right? And if you think about banking, you know, in the same manner, people don't wake up in the morning and say, hey, today I really want to buy a payment or I want to buy a mortgage, right? They want to get a new house. And actually, they don't want to get a new house. They want to get a new place for their family. And I think there is an interesting analogy here. So despite the difference, I see a lot of analogies. And Mark, how are you dealing with this? Because maybe we can learn a lot about, you know, what the healthcare industry is doing.
Again, in the past, everybody was functioning in their silo. Everybody was trying to optimize their silo. It's the doctor silo, the hospital silo, the home health silo, skilled nursing facility. Everybody was working the reimbursement system to really optimize their silo. And as we've done this and made this transformation for these innovative systems, these top 30, 50, 100 systems that I work with around the country, it's kind of been a big cultural transformation. The center of the universe of where all the decisions were made, where all the capital was allocated, where all the profit was made, used to be in the hospitals. And today the hospitals are becoming more like cost centers in these large health systems, and the center of the universe is moving towards the physicians that actually deliver that care. Collaborations are happening between partners that we just haven't seen. Other health systems partnering with health systems to serve their community better. In Wisconsin, actually, another state in the United States, statewide, there's about 28 health systems that are working together to say, what can we do to lower the costs, improve the quality, and improve the experience for our state? And so there's a lot of collaboration happening at a system level. There's collaborations with small med tech startups and others that are being brought into our organization to see, is there a different way we can do this better? In a sense, we're trying to re-engineer our factory, re-engineer the way we do our work, the way we deliver our care to create a higher value, lower cost, higher quality, better experience product for consumers. So we're seeing a plethora of collaborations happening across our industry. If we deliver a better product, a higher quality product that customers actually want, not have to have, but actually want, we're going to keep growing. Word of mouth amongst consumers about the experience that they're having, the Yelp reviews that they post on social media about us in the press, those are all impacting how patients are perceiving their care from us. So that's a big part of what we're trying to do, is grow by being better as a health system. And the last key strategy that I would lay out there for innovation is changing these organizations' structures to break down the silos. We're looking at how do we align our products and services to really meet customer need. Are we organized the right way? Do we have the right digital platform to serve our patients on an enterprise basis? Do we have the right sites of care? How often when you're looking for care, do you have to drive downtown to a hospital or a health system to get your care versus having that care either available to you in your community or available to you on your phone? These are the sorts of things that we're trying to do, is to say, how can we really design our products and services so that they're made and designed for customer need? There's all sorts of things that says, I'm not real comfortable with this new direction we're going. Let's go back to the way we did things. That's where my comfort zone is as a leader. And we found we really needed to lead that from the top, drive that down into the organization, and have a firm commitment to the change, the organizational change that we're seeking to enact across our organization. In simple terms, and this is something I led in an Indianapolis CEO role that I had, we moved the organization from having 8 emergency rooms that functioned at 8 hospitals to having 1 emergency room that functioned the same way at all 8 hospitals. And when you went to that emergency room as a patient, you could expect the same care protocols, the same experience, the same copays and deductibles, the same quality outcomes, the same clinical experience that you might have as a patient. There's a lot of variability, and so that holding company to operating company model is something that you'll hear a lot across my industry. So with that, I've covered a lot. I've covered a kind of an overview of the U.S. healthcare industry, 6 key trends that we're talking about in that space, 3 strategies for innovation, focusing on improving quality and outcomes, aligning stakeholder incentives, and changing these organizational structures to break down the silos. David, what are the similarities between these strategies in healthcare and banking?
No, I think there are a lot of things we can draw right from this, and things we could think in a different manner in our own sector, like banking, financial institution. And while you were explaining that, I took some note, at least what I would take home, and that would make me think maybe in a different manner. I mean, the first one is really the focus on outcomes, right? And measuring outcomes. And I think that the medical sector, the healthcare sector, does a much better job than banking at having a focus and measuring, defining and measuring outcomes at the level of the patient, at the level of the doctor that delivers the treatment. I mean, does it bring the outcomes? At the level maybe of a unit, like a surgery room, at the level of an institution, do we deliver the outcome? And we in bank, of course, we do measure things. We do sometimes NPS, all that thing, but I think we could go much, much further to actually define what we mean by outcome and making sure that we measure and that through measurement that we improve, right? I mean, how many of a customer in wealth management have the right portfolio, right? The portfolio they need, the portfolio that is efficient, and things that I think we can do a lot better in terms of outcomes. So that's one of the learning for me. Another one I noted is really, it's close to that, but it's also delivering to the clients what they really need, what they really want, right? And here, there's a tension between two different things which seems to be contradictory, but actually are not, and need to be blended together, which is this notion you highlight to remove variability, right? Variability is typically bad, right? If there is a best way to deliver treatment, it has to be delivered that way. And that goes to standardization and sometimes also automation and robotization, because sometimes the best way to make sure that it's delivered in the right way is just to automate and remove the human factor. At the same time, you put emphasis on the new role of the doctors, right? And on the one hand, you want them to just follow the things, right? And at the same time, they need to start having different dialogues about different things with the customer. What do they really want? Whether it's about the outcome of the treatment, because I say back to my example about, chronic disease or terminal stage diseases, right? The outcome, I mean, what you define the outcome, is different for different persons, right? And therefore, the doctor, the frontline, needs to have that dialogue with the patient, and that's really a one-to-one tailor-made dialogue to be combined with, removing variability in other pieces. So that's also an element of reflection for me, how we as bankers are going to combine robotization and normalization to deliver quality in a systematic and reliable and repeatable manner, while keeping not only the human touch, but actually delivering what our clients need. So it's a core challenge for me. Another one, and maybe the most important one for me is related to what you said at the end, right? And changing the organization, right? And the analogy that comes to me, right? You said, well, it has to be led from the top. This probably is the most important challenge, right? And the analogy, which is maybe a medical analogy, is that if you want to do something new, let's say in a bank, right? You want to innovate, you want to do a new business model, new ways of doing things. It's not going to happen unless you deal with the immune system of the organization, right? Every organization has an immune system, and it is absolutely important. You don't want people to improvise in brain surgery, right? You don't want them to experiment new things in an uncontrolled manner. The same applies to banks, right? You don't want people to deviate from processes when they deal with 100 million tickets, right? You just want them to follow the process, right? And therefore, there are a lot of controls in place, and the controls are obviously policies, units like legal, risk, procurement, culture, habits, and so on and so on. And if you really want to do something new, which in a sense, the analogy is you want to do a transplant, right? You want to grow a new limb out of the body or transplant something. If we don't deal with the immune system, which is your last part here, it's not going to happen, right? And therefore, for me, a key drawing, if we bankers are serious about these things, we have to deal with that piece in a very serious way, led from the top, but involving the entire organization.